Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Mahfuza binti Zainal. So my topic for today is occupational therapy support service in special education. Okay, so let's go. So it sounds similar: school-based occupational therapy, school setting, special education, and also support service in school. So my focus for today's talk is about occupational support service in school setting. All right. So the agenda for today is I'm going to talk about model and framework, and then I'm going to talk about occupational therapy in special education, like worldwide and Malaysia. And then I'm going to talk about laws and legislation, occupational therapy in special education, also support service in special education. Okay. So let's go to the model. So the model that I have been using is the Partnering for Change model by Misuwana et al. So this model is focusing on the parents, the educators, the students, as well as the occupational therapists. So these are the model that we use to provide service in special education. So occupational therapy in special education Malaysia, so this is the framework what we have in Malaysia. So in providing occupational therapy support service, we have the parents, and then we have the special education managers, we have students with special needs, we have teachers, and we have school administrators. So these are the people inside the occupational therapy service. So when we look at what are the services that we normally give to the children or in special education, so we do screening. It is like a short, very short test to know what are the problem of the students. And then we do assessment, we do intervention, we do home program, we do consultation to the parents, we do consultation to the teachers, as well as to the school. And then we do training, we do school visit, and then we also in charge in module or instrument development, and then individualized education plan or IEP, and then early intervention program, EIP. So we are providing these services in the system, in the special education system that consists these people: parents, students with special needs, teachers, school administrators, and special education officer. And then, so in providing these services, this is called occupational therapy service. And then what we are lack in providing the service is the practice guideline. So we really need to have this guideline in guiding our practice. So when we look in worldwide occupational therapy service in special education, we base on the idea, which is the Individual with Disabilities Education Act. So this is the federal law that ensures a child with special needs the right to a free and appropriate education provided in the least restrictive environment. So OT is a related service to assist a child assess their specialized academic instruction. We need to identify an area of deficit that directly impact on the child's ability to make meaningful progress in their educational program. So this is the concept of idea that we base on. So then we also base on the early intervention services, where we focus on children aged 3 to 6 years old who are not identified for special education but need additional support for academic or behavior intervention. So occupational therapy could support in terms of behavior modification, in terms of fine motor skills, visual motor skills, in supporting handwriting and craft activities. So we focus on school readiness related activities in supporting the special needs children. Other than that, we also look on the response to intervention, which is the RTI. It is a knowledge-based skills and a service delivery system that is intended to provide an educational experience to all students. In the section 504 of the 1973 Rehabilitation Act. This act is to prevent school districts from discriminating any child based on their disability, regardless of disability. So in comparison to Malaysia, Section 504 is similar to our zero reject policy, which prevents any children to attend schools. And then when we look on Malaysia situation, the laws and legislation in special education in Malaysia, these are that we bind to, the laws that we bind to. Akta Orang Kurang Upaya 2008, Peraturan Pendidikan khas 2013, and Kod Amalan Pendidikan Murid Berkeperluan khas. Okay, so these are the documents. You can get this online. Okay, so you can have this online, you can Google it, and then you can find this document, you can read through. Okay, so I would like to discuss about this, the approaches that we normally give our service, occupational therapy service that we normally give in special education. We have two approaches. The first one is the pull-out service. The pull-out service is where the student is taken out from the classroom to go for one-to-one occupational therapy intervention in therapy room, for example, or in maybe in other playroom. So the idea is we take out the student from the classroom. This is the pull-out service. The second approach is the push-in service. So the push-in service is where the occupational therapy enters the classroom to assess and support teacher to maximize student participation in school curriculum. So the idea is to get the occupational therapy into the classroom. Okay, so this is the push-in service. So here I have a few pictures. Okay, so this is the push-in OT service where the OT comes into the classroom to give intervention for the students. And then this is the pull-out service where the OT take out the kids from the classroom into the therapy room for one-to-one session. Okay, so the most important part in special education is individualized education program. So this is the what we call the heart of the program, the IEP. So every special needs children must have an IEP. This IEP is very individual, very holistic, very specific. So the definition is of IEP is it is a written document to record educational goals. Okay, so the purpose of IEP is to meet the child's education individual needs. All right. So who are involved in IEP? So the teacher, the parents, the school administrators, healthcare professionals. Healthcare professional is like the therapists, the occupational therapists, speech and language therapists, or maybe the medical team, the doctor. And then the student itself, the student with disabilities. So these are involving in IEP, in planning the IEP. So what contains in IEP? So it contains individual performance of the special needs children. It can be academic, it can be non-academic. So it must have short-term goals, long-term goals, and the goal must be realistic and can be measured. So in IEP, it contains a series or a planning of activities to achieve what we target for the kids to achieve. So we need to give support, like maybe the kids need support from therapy. What sort of therapy? Speech and language therapy if the kids have problem with communication, or the kids needs occupational therapy if they have sensory or motor skills problem or handwriting problem. So we need to include what support service needed by the student apart from the teacher itself. So all of this planning or series of activities to achieve the target, to achieve the goals, Like at the end of the year, we must make this child to be able to write with effective grasp. Or maybe, for example, we target the kids to behave properly in class, for example. That's very general. So these targets must be agreed by the parents, by the teachers, and by the therapists who are involved with this kid. So individual education program is very holistic, very practical for a child with special needs. All right, so this is very important. It can be academic and it can be non-academic, but most of the, actually it follows the kids performance. If the kids is cognitively able, so we can focus more on academic part. But if the child needs more on management aspect, like self-care or behavior, so maybe academic focus is not relevant to this one, to this kid. So we can focus on non-academic part, like behavior or sensory. Okay, all right. So these are the professional therapists in special education. We have occupational therapists, audiologists, clinical or educational psychologists, speech and language therapists, physiotherapists, and also we have visual rehabilitation. For visual rehabilitation, not necessarily we need to have a visual rehab therapist, but we can invite optometrists or any person who have background in vision, in vision experience. All right. Okay, so these are the professional therapy in special education. To talk more about this, in Malaysia, these professionals are actually mostly work with Ministry of Health, but outside our country, maybe in other country, like my experience in the UK, we have these therapists inside the school, right? Within the school or within the Ministry of Education. But to talk about the situation nowadays, we have occupational therapists, audiologists, speech and language therapists, educational psychology, clinical and educational psychologists within the Ministry of Education under the Pusat Perkhidmatan Pendidikan Khas, 3PK. So this 3PK is organized or managed by the Jabatan Pendidikan Negeri in each state of the country in Malaysia. So if you need this professional therapist in special education, you can contact Jabatan Pendidikan Negeri in your state. All right. So as an occupational therapist, what you can do in special education. So as an occupational therapist, myself, we focus on posture management, like sitting posture, handwriting. All right. So, I mean, posture in handwriting, something like that. And then we will also focus on fine motor skill, like handwriting, cutting skill, like using scissors, and then coloring skills. So these are the activities that related to fine motor skills. And then we also focus on gross motor skill. The gross motor skill is more on your body part, your movement, your balancing. All right. And then sensory integration. Sensory integration is something like sensory that impact sensory issues that impact a child's capacity to lead a life, something like that. For example, the child is very you know, maybe needs stimulation on oral, or maybe needs something on visual, like sensory part, because sensory intervention activities is quite a biggest part of our commitment in giving intervention for special needs children. And then behavioral modification intervention. This is actually behavior modification for special needs children is very related, very related with sensory, because most of the behavior issues comes from the sensory part. So as an occupational therapist working in special education, we need to analyze this behavior. What are the cause of this behavior? All right. So we can use rigid schedule. We can adapt applied behavior analysis, and then we use social story, and also we use reward system. And then as an OT, we also focus on cognitive skills, okay, like understanding instruction, following instruction, and also basic concept and academic skill. So these cognitive skills are like more to school readiness skills activities. And then activities of daily living skills, like washing and dressing, toilet training, and meal preparation skills. When you look at the components of OT intervention with special needs, you can directly link with what we have in special education syllabus or special education curriculum, because when we look on the curriculum, KSSR for Pendidikan Khas for special education, we have all of these things embedded in the curriculum. So I can say that we cannot deny occupational therapy services within the special education, all right, for the special needs students. So these are my observation after analyzing the school curriculum for the special education. Okay, all right, so the 10 occupational therapy job scope in special education. So I'm gonna explain what we do for special education. Special education means we also cater for the parents, cater for the teachers, for the schools, and everybody inside the special education. So the first job is we do screening. Screening is like a 20-minute, very quick test to look what is the problem that the child is having. For example, maybe handwriting or maybe sensory issues. So this is the screening, very quick, like 10 to 15 minutes or 10 to 20 minutes test. All right. And then number 2 is the assessment. The assessment is based on the specific goals. For example, if the kids have, if an OT wants to look more on the handwriting issues, so he will use assessment for handwriting. So handwriting is more specific. Assessment, it can be standardized or non-standardized. So it depends on the occupational therapist, what he wants to choose for the assessment. And then number 3 is the intervention. Intervention, we do individual intervention like one-to-one, and then group intervention, like a few of kids in one session, maybe not much, maybe 3 to 5 kids in one group. So this is called group intervention. And then joint therapy session. Joint therapy session is what we have 2 therapy, more than 1 therapy in one session. For example, occupational therapy and speech and language therapy in one session for the kids. All right, so that is called joint therapy session. And then number 4 is home program. Home program is designed specifically for parents. Home program is to support the parents what to continue after the therapy session in school or during the one-to-one with the therapist. So this is very important to make a continuation at home. And then number 5 is school consultation. School consultation we give to the parents, like we talk about, okay, you cut because in the beginning of the screening, so it might be the kids don't have any OKU cut. So we need to consult the parents on how to proceed. And then we also talk about special education programs, like what the kids will experience in special education programs in Malaysia. Like for your information, we have 3 special education programs in Malaysia. The first one is special education school, special education integrated program in typical schools, and then number 3 is inclusive program. So these three programs we need to clearly explain to the parents so that the parents understand and then they can decide the best for their kids, because the school decision is depends on the parents. So we need to, as an occupation, we need to explain this to the parents. So this is a school consultation. And then number 6 is classroom consultation. This is specifically to the teachers. Okay, so on this aspect, we'll be doing classroom accommodation or curriculum modification. This is not like actually this is like we suggest for the teachers. So for example, this kid need to be placed in this area. So for this kid, the teacher needs to do this thing. So this is a classroom accommodation, or like we modify a bit the curriculum to fit the child's need. All right, so as a teacher, as a special education teacher, you have rights to modify the curriculum according to your child's need. Okay, so as an occupational therapist, we will guide you. We can guide you how to handle your kids in your classroom. And then number 7 is a training program. The training program, we focus on giving to the teachers as well as the parents according to the needs. So we do lots of workshops. Okay, workshops is sometimes the school invited us to give the workshop, because training program is just part of our job scope. It's not our main job scope, but it can be, if we invite occupational therapy, we can give training. And then school visit also based on demand. If the school need us to come to visit the school, to look at the kids in natural setting in school, so we can come. So you need to apply under the Jabatan Pendidikan Negeri to invite our occupational therapists to go to your school. And then number 9 is for module, instrument, guideline development in occupational therapy for teachers, parents, and practicing OT according to focus and target. Actually, this is more on management skill. Like for example, our OT has been actively involving in developing or modifying instrument, guideline for teachers, for parents, to like supporting modules for teachers in the classroom. And then the last one is the evaluation report. This is more on occupational therapy practice. So this is very important, because in everything that we do as an occupational therapist in providing the support service for the special education, we need to have an evaluation report. We need to report that. So this is more on our practice. Okay, so I would like to tell about the occupational therapy job scope in line with national education policy in Malaysia. These three that we have been doing before. So number 1 is the Linus program. For your information, Linus program is no more, starting in 2018, if I'm not mistaken. So Linus program is we do screening, OT intervention activities in school. We do consultation to the parents, to the teachers, and also we provide home program to the parents. So these are the Linus program. But nowadays we don't do that anymore. But even though we don't have Linus program, but we still got invitation, or yes, we still got invitation from the Jabatan Pendidikan Negeri or directly from the school to do screening for the kids, because no more Linus, but the kids still need screening. So I can say that the screening in school is part of our job that in line with national education policy in Malaysia. And number 2 is inclusive education program. This is ongoing. So we do school visit, we do school consultation, we do classroom consultation. School consultation in inclusive education program is like we consult the, the school administrators, like the guru besar or pengetua, on how to place this kid within the classroom in mainstream class. And then maybe the classroom consultation, we do a program for the teachers who don't have any background in special education. So we need we do more on awareness program, and we consult them on how to handle these special kids in classroom. And then, yes, zero reject policy. So this is in line with the Section 504 Act, all right, that I have mentioned earlier, the laws and legislation for the special education. So in Malaysia, it is similar with zero reject policy. So in zero reject policy, we give training to the teachers, training to the parents. Okay, and then we do OT assessment. Then we do guideline development as well, all right, and also consultation because we receive a lot of reports from parents that their kids have been rejected from school. So we need to go to the school to consult them why, and then we need to consult if they need to if this teacher needs training on how to handle the kids in school, we will provide training. If the kids needs OT assessment, we will give the OT assessment. So these are the occupational therapy jobs that are in line with national education policy in Malaysia. All right, so the support service, in conclusion, the support service that we give in special education, like occupational therapy screening, psychology screening, speech and language therapy screening, audiology screening, IQ test screening, group intervention. For your information, IQ test screening is provided by the clinical psychologist. And then group intervention, joint therapy session, teacher training. Okay, so we have some more. We do school visit, consultation to teachers, psychoeducation on inclusive program. Psychoeducation means that we involve the typical kids to make them aware that they need to the acceptance of their special friends in the classroom. This is a psychoeducation that we have been doing. And then physical support in classroom. Okay, we do training inside the classroom, like sitting position for the kids inside the classroom. And then psychology service in school. And then we also do auditory verbal session in school. Auditory verbal session is given by our audiologists or speech and language therapists. And then we also give preschool support service. We also go to preschool to give advices. The preschool is not necessarily in government preschool. We also got invitation from the private preschools. So we also provide the service. And then the last one is environmental auditory intervention for students with hearing impairment. So this is more on our audiologists. So in conclusion, occupational therapy, speech and language therapy, psychology, audiology, and physical therapy are all examples of support services given to the special needs students. Collaboration between special education teachers, therapists, and parents are integral, very important in providing support service in special education. The need of support service in special education cannot be denied, as this would make better impact in providing the best special education service. A systematic practice guideline on how to provide support service in special education is very much needed to guide the practice. So that's all for my sharing session for today. So thank you very much for hearing me, for listening to me, and so I hope to meet you again next time. So okay, thank you and bye bye everyone. Assalamualaikum warahmatullahi wabarakatuh.